Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. In this video, we'll explore how family stress shapes personal trauma. This video is intended for educational and informational purposes only and is not a substitute for professional medical, psychological, or mental health advice, diagnosis, or treatment. Always seek the guidance of a qualified healthcare provider or a licensed mental health professional with any questions or concerns you may have regarding your mental health or well-being. Trauma is usually thought of as something that happens to us, an event, a loss, or a shock. Trauma, however, can also grow quietly inside the home through the way families handle stress or don't. This can shape how we understand safety, trust, and our own self-worth. Family stress isn't always dramatic. It can be financial strain, divorce, illness, emotional distance, or unspoken expectations. Every family faces its own challenges. What matters most is how those challenges are managed. When stress builds and no one talks about it, it changes the emotional vibes of the home. Kids, for example, are extremely sensitive to tension. They notice when parents or caregivers fight or withdraw, even if no one says a word. Over time, those patterns teach them what to expect from relationships, love, and themselves. When does stress become trauma? It happens when the nervous system is overwhelmed, when someone feels unsafe, unheard, or emotionally abandoned again and again. A child growing up in an environment that causes constant stress learns to stay on alert. They may become hypervigilant, where they are regularly scanning for danger, or they may shut down to protect themselves. Some survival strategies used are fight, flight, freeze, or fawn. If they continue into adulthood, they can look like anxiety, depression, people-pleasing, or emotional numbness. This kind of trauma is called relational trauma. It comes not from one big event, but from ongoing emotional disconnection. Even if parents or caregivers loved their kids deeply, constant financial strain, mental health struggles, or unresolved conflict can still create that sense of instability. The tricky part about relational trauma is that it and the stress are often passed down from generation to generation. If parents or caregivers never learned healthy coping mechanisms, they might unintentionally repeat patterns of silence, anger, or emotional avoidance. This is how intergenerational trauma forms. Studies show that chronic family stress can even affect a child's developing brain and stress hormones. Luckily, understanding this connection gives us a chance to break the cycle. Healing starts with awareness. You can't change what you don't name, but you can begin to notice your body's reactions, triggers, and patterns. Therapy, journaling, and open conversations with loved ones can help rewire old beliefs about safety and connection. Family stress doesn't have to define your story. Recognizing how it shaped you is the first step in rewriting your story into one of resilience, compassion, and growth. Thank you for watching this video on how family stress shapes personal trauma. The Office of Correctional Medicine at Southern Illinois University School of Medicine invite you to look for more educational content in our Health Matters series.